Hi, welcome back to our second brief lecture. I hope you enjoyed the first week of the course. This week we move from theory to getting a little closer to actual practice. We'll talk about stages of change theory and how that applies to practice. And we'll start to get into the first specific intervention modality that you can put in your clinical social work backpack, motivational interviewing. So let's take a look at these. We'll start with a little bit about MI, and then I'm going to go into change theory and give you some background in that. So MI is a very client-centered, somewhat directive method to enhance motivation and help people in their attempts to change problem behaviors, or maybe it's not a problem behavior, but make a desired change. And it focuses primarily on this thing called ambivalence. MI, it's brief. It's a brief treatment, and again, as I mentioned, it's really a set of strategies to help people with resolving ambivalence about change. Ambivalence being, I kind of want to change, but I don't know if I really do. Or someone's telling me, I need to change. I don't get that. I don't get it. That's ambivalence, right? It's brief. It's often done in one session. It can run from 1 to 4 typically. And in these days, we're seeing MI integrated in a lot of primary care settings and hospital settings, so where we have behavioral health folks. A lot of docs now are in our UNE osteopathic medical program. Some of us from social work are partnering with the medical faculty, and we're actually training tomorrow's doctors in motivational interviewing as well as social workers. So that's pretty cool. It comes from stages of change theory, which we're gonna switch gears and talk about in just a moment. A fellow named William Miller, he noticed he was originated with working with people struggling with alcohol and drugs, drug addiction, and he found that some of the typical approaches of that time, the late 70s and early 80s, it sort of was a tough love kind of, approach, and it was all or nothing. It was kind of, come in, you do a 30-day program, you get yourself sober, and then, you better get out there and you better do it and you better stay sober, right? And you get, there were a lot of other things that were good things, and there were good parts of that, and that tough love worked for some people. And there's also, of course, the 12-step program in the background for a lot of folks, and there still is today, and that's certainly a lifesaver for many. So William Miller says, you know what, we need something else. Some people, this is a tough thing, dealing with addictions, and it isn't something, it's not a light switch you just turn on and off. And so he came up with these strategies that focused on primarily these two issues, this thing called cognitive dissonance, which is that we, as human beings, we can't hold two completely incompatible beliefs at one time, right? We can't hold this belief that, we'll live forever if at the same time we think we're mortal, right? That we have this mortality, right? At some point our body gives out. You can't hold, spiritually is a different thing. I'm talking about physically. That physical body won't last forever, although cryogenics, who knows? We'll see. And the other is ambivalence. That human nature seems to be, we often have this inability sort of to choose between two beliefs or goals that are very, disparate in nature. So he put together a lot of strategies to deal with this, based on this thing called the trans-theoretical stages of change model, which emerged earlier than came out of the 60s and 70s, and had it was really breakthrough at the time, and it has huge implications for us in social work. I have this in the back of my mind every time I meet someone new, or I have a new client or an intake, or I meet, I'm automatically beginning to think, I wonder where this person is in terms of stages of change, because change theory says that we have this sort of cycle, and that you can be anywhere in that cycle, and it's not linear, and sometimes you bounce around, right? But there's this pre-contemplation stage where the person doesn't believe there is a problem, or they're not willing to consider changing. The next stage is contemplation, where we begin to think about it. Well, maybe, my partner's been telling me for a couple of years that, that I'm depressed and I just haven't bought into it, but maybe there's something to that. Maybe I should look at it. So I'm in contemplation now, right? We move at some point to preparation, which is beginning to make a commitment that, I think I want to change, and then action, where we actually make the change. And then it becomes about maintenance. And these were the first, originally when change theory came out, these were the 5 stages. More recently, a 6th stage was added of relapse, which is so important because we know now that change is not an easy thing. It isn't a one and done kind of thing. And sort of falling back is part of the change process. And I'd like to show you a more recent version of this that I personally like. What's happened here in terms of some of the labels, and what we have is we have pre-contemplation is still the same, contemplation is the same, and instead of preparation, now we have determination. I kind of like that. Person becomes more determined, right? Action's still the same. And then maintenance is the same, and then this is the big change that I really think is important, recurrence instead of relapse. How do you feel about that? How does that sound to you? I find this to be a more empowering, a more strengths-based kind of view. In other words, we had a recurrence of our previous issue. That's okay. We're going to get back into this. We're going to go back into action. You don't have to go through all the stages from recurrence. You can go from recurrence right back to action or maintenance, right? Which is, I think, very empowering. The other thing is this cool thing, and you have these resources in your course, learning resources as well. But I would encourage you to keep this, to print this and keep it handy. Because I have a little sort of pocket-sized version of this that, honestly, my first few years in practice after I got my MSW and my LMSW, clinical conditional, those first 2 years, I lived on this. I would pull this thing out even during session. It gives you guidelines on the things you want to do with an individual who's at each stage. For example, let's go to contemplation and look at what... So here we're going to encourage the person, we're going to help them explore their sense of self-efficacy. How do they feel about that? Expectations. We'll be helping to summarize, and we're looking for self-motivational statements, which we'll talk about in a moment. But then when you get over to action, you can see our role changes. Helping people with coping strategies, support. I think this guide is priceless, I think. Obviously, you can tell maybe I'm a little bit excited about it. I highly recommend you print it if you haven't gotten that already. So back to MI. From stages of change, then MI is helping people to move through those stages, and it's a collaborative process. It's an optimistic process. It should be supportive, not judgmental or too dictatorial. Major assumptions here are, and you might be wondering, why did Craig pick that picture? I don't know. I just love the picture of this man. I don't know. He looks like somebody who's really contemplating something. I'm not sure if it's a change or what it is, but so major assumptions of MI. Back to the point. Motivation to change should be elicited from the client. It's not from us. It's not our change, and it often our ability to change is impeded by ambivalence that we talked about earlier. This inability to sort of make a decision, or decide if we even want to make a decision. And MI helps us to do that. MI helps us to resolve that ambivalence. What we found, what Miller found and some other folks, was direct persuasion. Just telling people why they need to change and telling them to change wasn't effective. And I would imagine you can relate to that yourself. Someone tells you to do, you will do this. Well, I mean, what's the likelihood, right? So some of the core principles of MI are empathy. We do a lot of reflective listening. We'll move into person-centered in this course, and you'll see some similarities, actually. MI drew a lot of, the MI intervention model draws a lot from Carl Rogers and person-centered theory. We don't argue with the client. We do this thing called roll with resistance. So, and now it's actually, resistance has now been renamed to reactance. If somebody's just reacting, they're not resisting, they're reacting. And we roll with that. It's sort of like martial arts, you know, where somebody's coming at you with an aggressive move, and you go with the move, and you, instead of you know, engaging it directly. So it's a really cool way of working with somebody who's, you know, sort of struggling with whether or not they want to make a change, and helping them to sort through that. We know, of course, and this won't be anything new news to you, that people need to be, the client has to be ready to change. It's not you making the change. At some point, they need to make the change. What we also know is that once people are ready, change can occur quite quickly. That the more people argue for change, right, then the more likelihood it will occur. And so one of the things that sometimes happens in MI is sort of a paradoxical thing, where we may start taking the role of telling the person, well, you know, I don't know, I'm not hearing that you're quite ready for this. Maybe you're not. It's okay. Now the thing is, my thing is, I don't think we should manipulate people. And MI can be, it's one of the criticisms, it can be used sort of in a manipulative way. It does not have to be. You can use it in a very strengths-based, empowering way. Part of a big part of assessing throughout MI how a person's doing is this concept of reactance. That used to be called resistance, another nice change I love, now called reactance. When somebody's pushing back, they're arguing, interrupting, denying, ignoring, those are signs that they're not quite ready. You've missed something. You need to go back and help work with them in contemplation or pre-contemplation. You need to help them look at the benefits and pros and cons of changing or not changing. The actual intervention is, as I just have been saying clearly, it's beginning where the client is, and accepting their perceptions as valid, reinforcing their statements. Anytime they make what we call a self-motivational statement, we're going to really capitalize on that, really reinforce that. And those self-motivational statements, or SMSs, indicate the desire to change. It can be just a small thing. You know, somebody's been meeting with you for their second session around some harmful eating issues they've been doing. Maybe they've been binging, and they kind of haven't indicated that they're really willing to look closely at that or make any changes. And then all of a sudden, they're talking with you right now, and they say, you know, I woke up in the middle of the night and realized, you know, maybe something does have to change. That's an SMS. That's a self-motivational statement. That you're gonna really, you know, grab onto that and nurture that with the client. So criticisms we mentioned, we'll wrap up here. There have been criticisms that MI can be a little limiting. It's just focusing on motivation, doesn't go into the underlying issues. It's, you know, it may not explore trauma in the ways that we would want to in trauma-informed practice. It might not always factor culture in. There's a variety of things. And the biggest thing that I said, as I mentioned, it can be manipulative, but that's how you do it, right? You don't have to. You can use these principles. They're wonderful, and not manipulate people. And as I said, for me, it's rarely a single intervention. It's usually pieces of other interventions. So you'll get a chance to dig into this week. You'll go into the core principles, and you'll look at how to use MI in practice. I hope you enjoy that, and I'll see you in week 3. Take care.